Hello, my name is Dr. Sanjay Malia, and I'm an oral and maxillofacial radiologist at the UCLA School of Dentistry. X ray based imaging is an important diagnostic tool in healthcare, including dentistry. An understanding of the nature of radiation will allow us to intelligently communicate radiation procedures and risks to our patients. Dentists also oversee the regulatory requirements for X ray based equipment. This includes periodic equipment maintenance and calibration, and designing radiation safety programs for their offices. This presentation provides an overview of electromagnetic radiation and its application in diagnostic imaging. It also introduces the terms ionizing and non-ionizing radiations, which have important implications for radiation safety. Finally, through illustrative cases, it demonstrates the uses of radiation in diagnosis and treatment. You may find it useful to review some key foundational concepts, in particular the atomic structure. This forms the basis for production and interaction of X-rays. The broadest definition of radiation is propagation of energy through space and matter. Radiation may be particulate in nature, that is, charged or uncharged particles that have a mass and kinetic energy. Examples include electrons, protons, neutrons, and alpha particles. In contrast, electromagnetic radiation, also referred to as photons, are packets or bundles of energy with no mass and no charge. Electromagnetic radiations are considered to have a wave-like motion and propagate as electric and magnetic fields that are at right angles to the path of travel. Electromagnetic radiations travel in a straight line with a velocity of approximately 300 million meters per second. Electromagnetic radiations are characterized by three interrelated parameters: wavelength, energy, and frequency. Typically, the wavelength is expressed in nanometers, the energy as electron volts or more frequently kiloelectron volts, and the frequency as hertz or megahertz. In practice, X-rays are most often described by their energy in kiloelectron volts and occasionally by their wavelength in nanometers. The relationship between energy and wavelength is straightforward. Energy is inversely proportional to the wavelength. Thus, electromagnetic radiations with longer wavelength have lower energy, and radiations with shorter wavelength have higher energy. The electromagnetic spectrum comprises of radiations with differing wavelength and energy. Note that in daily life, we encounter many radiations in the lower energy end of the spectrum. This includes communication waves, televisions, cell phones and other wireless devices, microphones, and airport screening. Photons with energies greater than 10 electron volts have the ability to cause biologically relevant ionization, identifying a subset of the electromagnetic radiations that are referred to as ionizing radiation. Due to the ionizing nature, these radiations have the potential to cause biologically relevant ionizations and potentially biological detriment. From the perspective of diagnostic imaging, this detriment is the potential risk of radiation-induced cancer. Such radiation-associated risks limit the application of X-ray based imaging in patient care. In contrast, magnetic resonance imaging, another diagnostic imaging modality, uses electromagnetic radiation at the non-ionizing end of the spectrum. This makes magnetic resonance imaging much more safer for our patients than X-ray based imaging. This caution radiation symbol is used to identify locations where radiation hazards exist. These include dental offices, where X-ray machines are located. Next, let's consider the application of radiation in healthcare. Conventional X-ray based imaging continues to be an important component of dental diagnosis and treatment planning. It provides us valuable information on teeth and hard tissues that cannot be determined by clinical examination alone. Computed tomography is an advanced imaging technique that uses X-rays but provides an added advantage of providing information in three dimensions. CT imaging is used in dentistry for a wide range of applications, including evaluating dental disease, planning for dental implants, evaluating cysts and tumors in the jaw, and much more. Unlike the previous two modalities, magnetic resonance imaging uses non-ionizing radiation and thus is safer for patients. However, magnetic resonance imaging provides limited information on teeth and hard tissue, and we continue to rely on X-ray based imaging to provide us that information. The case here demonstrates application of magnetic resonance imaging to evaluate the temporomandibular joint. The articular disc can be clearly identified and provides valuable information in terms of its morphology and location. The previous examples were very effective in demonstrating the morphology or anatomy of the region that was being examined. In contrast, nuclear medicine is an imaging modality that provides us with information on the functional activity within a tissue. In the example shown here, a bone scan was performed to evaluate activity of bone growth in a patient with unilateral condylar hypertrophy. More advanced techniques will fuse functional and morphological imaging. The example demonstrates a patient with metastatic breast cancer that was imaged to evaluate bone metastases. Areas of hypermetabolic activity within the bone are identified using nuclear medicine imaging and superimposed over the morphology provided by a CT scan. Beyond diagnosis, radiation has therapeutic applications. Ionizing radiations can cause biological damage and cell death, an effect that has been harnessed to effectively treat neoplasms. You should now have a better understanding of the basic nature of radiation, and in particular understand the terms ionizing and non ionizing radiations and their implications for associated radiation risks.